Hi, good morning, Georgie. My name is Mihira. I'm your invigilator for the OET-speaking session on the 30th of June 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Georgie Cooper.
And what is your candidate number?
My candidate number is 232302323.
Okay. Are you taking this test as a nurse?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has got a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living, and economic and political stability. Besides, there, nurses are paid well, and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
How do you ensure you remain up to date on advances in nursing?
I use several approaches to remain up to date. Along with continuing education courses, I subscribe to several industry publications to learn more about what's on the horizon. I also follow thought leaders on social media, giving me additional insights, and converse with my network regularly to find out about their discoveries.
Would you be known as a nurse?
I would like to be respected as a nurse. I have the dignity of being a nurse. Being a nurse makes me proud, and I want to be recognized for my competence and productivity. I value the highly professional nature of my relationship with my colleagues, and the ethics I demonstrate in my profession.
What qualities do you possess that make you a great nurse?
As a nurse, I am committed to prioritizing compassion and care in my interactions with my patients and colleagues. I understand the importance of effective communication within my team, and always strive to show courage when presenting concerns to doctors and more qualified colleagues. I'm committed to a career that involves continuous learning, and am confident that the qualities I bring will help make a difference in the lives of others.
Do you find that communication skills are important for a nurse?
Communication and interpersonal skills are of the utmost importance. Nurses must communicate effectively with senior medical personnel, patients, and the staff. But they must especially be good at communicating with the patient's bystander or family.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role plays to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Good morning. I'm Georgie Cooper, one of the nurses here at the emergency department. How can I help you today?
Good morning. My name is Mihira. I was bitten by a cat, and I came here to get some advice.
I'm sorry to hear that. Mihira, could you please tell me in detail about the cat bite?
Sure, why not? I got a cat bite on my right arm, near the elbow. It seems to be less severe, but I thought getting medical advice would be a better thing.
I appreciate your decision to seek medical attention. Mihira, would you mind asking some questions to get more information on cat bites?
No worries. You may please go ahead.
Thank you for your permission. Well, Mihira, how did it happen?
Well, I was visiting my friend, and he has a cat. It seemed friendly at first, but when I tried to stroke it, it suddenly bit me and tried to scratch me.
That's unfortunate. Cat bites can be quite serious and require medical attention. They can cause puncture wounds that are deep and hard to clean. They can also introduce harmful bacteria into your body that can cause infection and complications. By the way, Mihira, did you do anything to treat the wound?
I washed it with some soap and water and put a plaster on it. But it still hurt and looks red and swollen.
Okay, let me have a look at it. Can you remove the plaster for me?
Sure. You may please have a look at it.
The wound is quite inflamed, and there is some pus coming out of it. It might be infected. We need to clean it properly and apply some antibiotic cream to it. Mihira, when was your last tetanus shot?
Tetanus shot? I don't remember. What's that for?
Mihira, tetanus is a serious infection that can be caused by bacteria in animal bites. It affects your nervous system and can cause muscle spasms and even death if not treated properly. The tetanus vaccine can prevent it, but you need to get a booster every 10 years.
Oh, that sounds scary. Nurse, how do I know if I have tetanus or not?
Don't be tense, Mihira. Actually, we cannot say for sure yet, but we need to be cautious. You should get a tetanus shot as soon as possible to protect yourself from any potential infection.
All right then. I am ready to take it.
That's a good decision, Mihira. Before we proceed with that, may I know your pain status?
Yes, pain is quite manageable.
Great! Now, let me explain the next steps in your treatment procedure. First, we'll use some saline solution and gauze pads to gently clean the wound area.
That sounds great.
The next step is to see the doctor, who will examine your wound and prescribe you some antibiotics, if needed. The doctor will also give you a tetanus shot.
Okay, will it take time?
Mihira, I am sorry to say the exact time of the consultation. However, it is very important that you see the doctor as soon as possible because cat bites can cause severe problems if left untreated. I hope you understand the importance.
Yes, I understand.
Afterwards, we will apply some antibiotic cream on it to prevent infection. Then, cover it up with a sterile dressing so that it stays clean and dry.
All right. That's fine.
Do you have any questions or concerns?
No, not really.
All right then. Do you consent to have the tetanus shot?
Yes, I do.
Okay then. Please wait here for further instructions from the doctor regarding your wound treatment and tetanus vaccination.
Okay, nurse.
Thank you for coming in today and cooperating with us. I wish you a speedy recovery.
Thank you. That is the end of your OET-speaking role play. All the best.
Thank you, Mihira.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.